A graduation took place this week for a group of people hoping to advance in the field of community health. The program is offered by ABCD with the help of federal stimulus money. Joining us are one of the graduates, Jocelyn Taveras Garcia, and the director of the Community Health Workers Initiative, Kenya Elisa McLaren. Thank you both very much for being with us.
Thank you.
Thank you.
I want to with Kenya Elisa McLaren, to talk about the different kinds of things that people in this program will be able to do better as a result of the training that they're getting.
Okay, so the students who graduated with us today are training to become community health workers. They are being trained to combine standard public health, human services, outreach techniques with their own diverse backgrounds to provide information and services to people who are at risk.
Now, what about the odds of them finding work right now in this field?
Well, actually, we've had a pretty good outcome so far. Our first class, which graduated in May, of 23 students, we have 17 who have already obtained unsubsidized employment. So we continue to work with graduates when they finish to help them find employment in the field.
Sure, Jocelyn Taveras Garcia, the kinds of things that you learned, tell me a bit about that. What did you learn?
I learned how to work with people, no matter their race and or background. How to be more like to assist them with any type of help that they really need, you know, because there are a lot of people who need our help as a community health worker. So,
what would you like to do? What kind of people would you like to work with, at least as a category of need?
yes, I would like to work with older people. I think that I'm very passionate about it, so I think that is the right person that I choose, because that's what I'm passionate about.
You had some experience working with the elderly, maybe in your family?
Yes. First of all, I got 44 credits in gerontology, human services, and while I was working as a pharmacy assistant, I also developed those, that feeling for elder people, because I think that they are very vulnerable. And after I came here to Boston, I helped my husband's grandmother. She passed away 3 years ago, and I used to help her. She was in terminal cancer, liver cancer.
Now, talk about the importance of being able to communicate with people. And there are a lot of people in Boston whose primary language, like yours, would be Spanish. Mm-hmm. Now, even just filling a prescription, people have questions, they have concerns, they get frustrated sometimes, right?
Yes. So, to translate all the details about the medicine, I think that now it's growing more, the bilingual people. So, and we need help, bilingual people, to go out there and help our communities.
Kenny, I guess that's one of the most important things about this program, is that people connect at least more readily, and that, I guess that improves the services, right?
Oh, definitely. I mean, as you know, Boston is a very culturally diverse city, and having individuals who bring their own unique experiences, like Jocelyn and many of our other graduates who are multilingual, it's Spanish, we have some who speak Haitian Creole, other languages, Portuguese, who can go out and help people who are being underserved. That is the success of our program.
Now, what's also going on at the same time at the state level is there is a new voluntary certification program, and of course, appropriately enough, State Representative Gloria Fox, who was speaking at the graduation, she was one of the main people in bringing this about. Why is this so important?
Well, Rep. Fox was the lead sponsor of the Community Health Work Board of Certification bill, and it's key because it helps to bring recognition to the field of community health work. Most people don't know what a community health worker is, but if we said a promotores or a health educator, then they would understand. So again, the Board of Certification further professionalizes the field of community health and brings more recognition.
By the way, I imagine you're going to have some more classes. There's still a chance for that, maybe?
Well, we are looking into that as of now, because this is ARA funded. We've graduated our last cycle for now. We're still working with our executive director, CEO, John Drew, to look for funding for additional trainings.
So if people want to find out any more updates on this, they can, I guess they can look online. You've got a website at ABCD?
We have a website, the www.chwinitiative.org, or they can contact me, and I can give my telephone number, which is 617-348-6591, and that is my direct line.
Thank you very much for being with us, Kenya. Elisa McLaren, and also with us, Yoselin Taveras Garcia.